also thank Dr. Kilada and Dr. Ganga Khedkar for giving me this opportunity to talk on frailty. Definitely not because of my experience in this area, probably because I look frail among the other speakers among this panel. Here, this is my plan of this talk. Yesterday, Dr. Usha discussed about the issue of aging in old age. Let's start from there, because many times aging and frailty are seen synonymous, even though it's not. Age doesn't necessarily be frail, and the other way around also. There are some statistics on what percentage of people are old age among HIV. I just went through my own state. It's around 20% now, about 45 to 50 years now. But in the West, it's much more than that because of various reasons. But definitely, Indians are getting older. We'll have more patients with HIV also aged. So that's one reason for frailty. And there is definite evidence to show that aging affects the frailty. HIV increases the chance of frailty, and it's related to aging also. There are some other similarities between aging and HIV. At the cellular level, both causes T lymphopenia. It causes replicative senescence of T cells, and there's increased inflammation. Also, both causes sarcopenia, cognitive disorders, etc., etc. But what's frailty? One of the definitions is that it's a syndrome, which includes enhanced vulnerability to stresses. And it's thought to be due to dysregulation of multiple physiological systems, and which leads to functional impairment, which may be reversed. Definitely there's a decrease in functional reserve during this process, and impairment of dysregulation of various organs. Age is definitely a factor, but it's not the only factor which causes this syndrome. Lifestyle, genetics, and environment are the important factors which affects this syndrome. The chronic infections like HIV and HCV related to more incidence of frailty, which probably affects various systems, which causes weakness, exhaustion, etc., which are part of the frailty syndrome, and which leads to health impacts like falls, dependence, death, disability, etc. So that's the process by which this syndrome sets in. Another way of looking at it, there's weight loss, which is associated with sarcopenia, decreased strength and power, decreased activity, and it's a cycle. There are two ways to look at it. There is one concept which thinks it's a syndrome, which, like I discussed, among them the 5 important points are slow movement, weakness in hand grip, and reduced level of activity, loss of weight or sarcopenia, and the people feel exhausted, self-reported exhaustion. There's another group who think it's just an accumulation of deficits, which happens to illness or the aging process. So it's a restatement of the same thing. Gives little more details of how to assess each one of these points. Definitely, we can quantify them, and there are studies in the West. Unfortunately, in India, there's not been studies on that, so whatever I discuss is from the West. That may not be applicable directly to India because the scenario is entirely different here. or in the developing countries. But that's all the evidence we have. So these are the factors which may help us to quantify the problem. And there is evidence from the pre-heart era that those who seroconverted or have become HIV positive are 9 times more likely to be identified as frail. It's probably common sense only, but there's evidence to that. And also, HIV infection is associated with earlier occurrence of frailty-related phenotype. And also duration of HIV infection, fall in CD4, and advanced disease. All the 3 are related to the frailty. And other factors related to frailty are depression, diabetes, kidney diseases, hepatitis C, cigarette smoking. All this even in pre-ART era. In the ART era also there are some studies on what's happening in the ART era. One important thing which we all know is the frailty syndrome has come down drastically after ART. Again, understandable. But it is now more associated with HIV-associated non-AIDS conditions, because we are seeing less and less AIDS-related conditions. And frailty is associated with both CD4 count and viral load, low CD4 and high viral load. There are many other factors which are related to frailty, similar to the pre-heart era, CD4, viral load, etc., etc. And also features like lipodystrophy, duration on ART, cognitive impairment, various inflammatory markers, and also socio-economic factors like lower education, current unemployment, etc. Many of us know this VAX index, which can predict the outcome of HIV infection, and that also is related to the frailty. We can predict, VAX index can predict not only the morbidity, mortality, but it can predict the frailty also. And those who are frail are more likely to be hospitalized, and this frailty is more in sick patients. Also, it can be correlated with cardiovascular morbidity, which we discussed in the morning, osteoporosis, and many other non-HIV related morbidities. So a big list of diseases which are associated with frailty, which probably we discussed already. And it's definitely related to mortality. HIV being or frailty, either can be 3 times more likely to be related to death, and those who are having HIV and frailty are 7 times higher, have a 7 times higher likelihood of death. So frailty, even in ART era, is something which we should see with due importance. It's the same thing. Treatment. Other than ART, ART definitely reduces frailty and reverses frailty. Other than that, the only thing which is proved beyond doubt is exercise to improve the frailty. There are many other interventions like testosterone, estrogens, nutritional supplementations, interventions, vitamins being propagated, but there are no real good evidence to support this, any of these interventions. Why is it still important? We don't know the impact of starting ART early in frailty. If we start ART before 500 CD4, will it reduce chance of frailty? We don't know. Probably we may have to do some work on that. It can be associated with untreated HIV. Yes, that's true, but may persist even after heart and viral suppression. So is there any difference, real difference between those who are on ART and not on ART? Because most of our patients, or most of our HIV positive individuals have almost normal lifespan now, or life expectancy. So how's it going to affect in the future? Frailty maybe is completely preventable as far as HIV is concerned, and we need better understanding about the mechanism. So these are the areas which probably we should look into, and we will reach a stage where people are frail in spite of, not because of HIV disease in the near future. Thank you.
Thank you.
Now I request the chair. Dr. Nalin Nag. Dr. Mat. Dr. Franco. Dr. Ajithkumar.